Assalamu alaikum, the clinical day. Mr. Adam Smith, 45 years, complaining of easy posing. His initial labs, hemoglobin 10, eosinophils 2.1. His vitals, blood pressure 110/65, temperature 57, heart rate 94, saturation is 95. We will start in seconds. Okay, here you go, Doctor.
Hello, Assalamu alaikum. My name is Dr. Azhar. Are you Mr. Adams, 45 years old?
Yes, doctor. I am Mr. Adam and I'm 45-year-old.
Okay. Today I'm here to discuss about your health problems, and I will also, during this consultation, I will also take some notes. Rest assured, all these will remain confidential. Is that okay with you?
Yes, doctor, it's fine.
Okay, can you please explain me, because I have noticed that you have some easy bruising. Can you tell me in detail?
Doctor, I recently noticed that when I bang my hand or my arms with any, even sometimes I don't remember what happened and why there is a bruise there. And they are, you can say, large, noticeable. Even my wife noticed them. So this made me worried, actually.
Sorry to hear about, and we will try to solve your problem. Can you tell me for how long you are having this?
Actually, I can say that it was happening before, but less frequent. At least it would be moderate to severe trauma, which can lead to bruises. But since you can say now, like 1 month or maybe slightly less than 1 month, a month when I noticed spontaneous bruises.
And before you were completely all right?
Before I used to have, usually you can say after even moderate, trivial, but it was not big, not noticeable, maybe once per month, twice, not more than this. But I noticed this maybe 3 months ago, 3 months ago. But the one which is noticeable and big, the last 3 weeks or 4 weeks.
It started suddenly, 3 months, or gradually?
No, everything went gradual until I felt that something wrong is going on just now.
Okay. Have you noticed anything increases this your problem?
Mainly maybe if I really was working, you can say sometimes I have like a small workshop in the yard of my home where I like to make some crafts, some, homemade stuffs, homemade boxes. So when I used to have this kind of work, I really injure my hand too much. So this is what mainly triggered those bruises.
Anything help this, improve this?
I couldn't really find anything. It was like, just like there, nothing to be done for those bruises.
I just want to know any past medical history you want to tell me, which will be significant.
Actually, in the past, I had a malaria infection. Okay. And also I had, I think that's the only thing which I really had to take a long course of medication for. And I just have headache on and off, for which I take paracetamol. That's it.
And malaria, when did you have the malaria?
It was like 4 or 5 years ago when I get this malaria infection.
And did you take the treatment at that time for
Yes,
malaria?
I completed the anti-malaria treatment.
Okay. Now, for the headache, it is still going on, off and on, or?
Yes. Do you know, I have this kind of headache, especially working in a noisy place in this work shop I told you that I have. So the drill, the machines I'm using, sometimes I get this headache at the end of the day.
Sometimes at the end,
Mm.
end of the day. And
Yes, on and off, not frequent. And I think it is still the same.
can you tell me what is the character of the headache?
You can say it's dull aching all over my head.
dilating all over your head.
Mm.
Do you think it's a band like?
Sometimes band-like, sometimes it is like, heaviness in the back of my head. Sometimes it's like, throbbing. So it depend. It depend on what trigger it and how much I was busy that day, whether I took the painkiller early or not.
Hmm. If I will give you the pain scale from 0 to 10, how much you will rate it?
I will rate this pain like you can say 4, 5, maximum 5.
In a week, how many times you are having these attacks?
Not much.
Much. And in which part of the brain you are having this? The whole part or some part?
No, no, I told you in the back of my head. I send you the picture of the patient.
Okay, in the group.
Mm-mm.
Is there anything have you noticed that increases your headache?
Nothing more than having a busy day.
Nothing?
Nothing
Excuse me.
more than having a busy day.
Busy day.
Mm.
Busy day. And anything which improves this?
Paracetamol, having rest, enjoying my weekend. You can say it make everything fine.
Can I see your medication list?
For now, I'm just taking multivitamins. And I'm taking this paracetamol on and off. And sometimes I take PPI for gastric burn after heavy meals. My GP prescribed for me this medication as needed.
Mhm. Any family history?
Nothing concerning.
Okay. Do you have any allergy?
No,
Any rash?
no.
Uh, any past surgical history?
Except if you will consider the bruises rash. Past history, I told you the malaria infection.
Okay. Any rash?
No, no. Other than the bruises, nothing.
Anything else? Okay. Do you, do you smoke?
No,
Do you drink?
no.
Do you drive?
Yes, I drive.
Okay. What is your job?
I'm working in a charity projects as an organizer since long time.
How it is affecting your job?
Actually, the process itself just it's hindering my hobby, but my job itself, nothing much. Just like you can say my activity is lower than usual. So I'm not participating in a lot of charity activities like before. I don't know why, but it's fine for me. I'm doing whatever I can do according to my tolerance.
Is there any yellow discoloration of the eye?
I think yes, my wife she noticed this.
Uh, okay. For how long you are having this yellow discoloration of the eye?
I think it started, you can say 2 weeks ago, 10 days ago, something like this.
And before you don't have any yellow discoloration.
Before, I don't remember that anytime anyone commented.
Okay. You have any problem with your water work?
My water work is fine.
Any any change in the color?
No,
Any bleeding from any orifice of your body?
no.
Any problem with your bowel habit?
I'm just having some kind of constipation on and off, but in between, my bowel habit is fine.
Okay. Any shortness of breath?
Shortness of breath, Recently, I told you one of the things which really bother me when I do a lot of activities is tiredness, maybe also shortness of breath is there. Like I cannot visit multiple sites at the same time. I cannot organize, more than one event at once.
This tiredness. And this tiredness is for how long?
It is there for 2 to 3 months since I
Two,
noticed my activity is less than usual.
2 to 3 months.
Mm.
And do you have fever?
No,
Any changes in the weight?
my weight is, you can say, stable, more toward losing. I noticed that I lost like one size.
One size you
I'm
mean?
wearing now, yes, less by one size.
One size, what do you mean? How many kilo?
I don't know, but I used to wear like large. Now I'm wearing medium.
Mhm. Your and what about your appetite?
Do you know, I cannot judge because being busy, I only eat when there is time. And but anyway, I'm not too much into eating.
Any night sweating?
No,
Any lumps and bumps?
no.
Any joint pain?
Uh, yes, I have sometimes joint pain in my knees and in my wrist.
At what time you are having these?
At any time during the day, no specific time.
There's no specific time. Any thickening of the skin?
No, my skin is fine.
Any cough?
Um, Cough, no,
Any racing and pacing of the heart?
no.
Any tummy pain?
Tummy pain, yes. I have some kind of tummy discomfort.
Hmm. And for how long you are having this?
Uh, it is also, I'm noticing it for the last, you can say, 1.5 month,
Mhm.
more in the last 3 weeks.
Mhm. And this tummy pain is increasing with anything
Nothing exactly is making it worse, but it's worsening by itself.
itself. Anything relieving this pain?
No,
No. Okay. Do you have any difficulty swallowing?
no,
Any acidic taste in your mouth?
no.
3 minutes, Dr. Azhar. 3 minutes left.
Huh? 3 months. Okay. Okay. Mr. Adno, I want to examine you.
What do you want to examine?
I want your eyes.
There is visible jaundice, as you can see. Anything else you want to check?
Any pallor?
There is pallor.
Pallor. And there is any mouth? Then I want to check the mouth. Any mouth ulcers?
No mouth ulcers.
I want to check the tummy. Any superficial palpation, deep palpation, and on inspection, I want to see if there is any scar, any abdominal swelling.
See, there is abdominal distension, which is obvious when you are inspecting the abdomen. There is no scars, and there is no superficial masses, which are visible by inspection, and
And
no pulsation. So what else you want to check?
any hepatosplenomegaly.
Yes, there is hepatosplenomegaly. Around like the liver is by like 4 centimeter below costal margin, and the
Mhm.
spleen is also around 4 to 5 centimeter below the costal margin.
Okay. And I want to check the pulse and BP.
Pulse and BP, light outside.
Okay. Any bronzing of the skin, any tanning of the skin,
No, doctor, no, the skin color is the same.
skin color same. Any spider nevi, any gynecomastia,
You couldn't elicit spider nevi and gynecomastia in the chest.
any caput medusa,
Dilated veins around the umbilicus? There is no. There is some dilated veins over the chest.
Dilated veins of
1 minute left.
okay. Any the flapping tremor in the hand, clubbing,
Flapping tremor. There is no flapping tremor.
any chylonychia,
No,
palmar erythema.
no. You
No.
can see the palms are red. Okay, we can say there's palmar erythema.
Okay. Okay, Mr. Adam, what is your concern?
Doctor, why do I have this easy bruising? And is it something serious going on since I'm feeling like low fatigue, or it's just the stress of work?
I appreciate your concerns. I will make multidisciplinary teams and I will want to run some tests. And when I will be having these results, I will be discussing with you. From the history and examination, it looks to me that you have some problem that is related with your. I think it may be uh, some your liver and spleen. So I want to have some blood tests and some scans of the tummy. Then I will inform you. Is that okay with you?
Okay, doctor, I have to travel to an event after 3 days. Do you think it's possible for me to travel?
No, it's better if you first we will complete our investigation and we just want to know what is actual diagnosis. Then I will let you know. Is that okay with you?
Okay.
Do you have any other
Oh,
concern?
no, doctor, thank you.
Okay, time is up. Almost 1 minute extra. You can start examine question, please. Dr. Hay.
So, Dr. Azhar, can you summarize the case, please, for me?
Okay, Mr. Adam, you are having easy bruising from the last 3 months, which is actually worsening from the last 3 weeks. And it is more when you are doing some contact work and you are also having a headache that is coming on and off.
Mm-hmm.
And you are also having tummy pain that is also off and on. And on the examination, I can found you are having jaundice, and on the tummy examination, you are having hepatosplenomegaly,
Mm-hmm.
and also you are having constipation. On the basis of this, I have some options. It may be due to you are having there is a one there's a bug infections in your body, or it may be due to some chronic liver disease.
Bug, okay, which kind of bug you are expecting?
I'm not sure at this time, but I will.
Anything which can make it very easy for you to expect what type of bug? And it was there in the scenario.
Eosinophilia.
Yes.
If eosinophilia, it may be uh, schistosomiasis, maybe
Mm-hmm. Somewhat.
someone a schistosomiasis we can expect. Uh,
Okay. Agree. Based on this eosinophilia, so it could be parasitic, so some kind of flukes infection, parasitic infection, something like this. Did you explore about his traveling history,
yes, I forget.
especially he's
I,
working in a charity company,
I,
bloodborne viruses risk factor, sexual history, those stuff which can help. Anyway,
I,
uh, let's say it's kind of a bug infection based on the eosinophilia. I can suspect that it can be schistosoma or any other culprit organism. Okay, what else? What other differential you are expecting for this gentleman for easy bruising?
it may be some viral infection, maybe. It may be HIV infection. It may be HIV infection, but I did not take the complete history. And
Okay.
Uh,
So tell me
I-
how you will investigate your patient.
Along with the basic investigation, CBC, ESRC, recti proteins, LFT, RFT, and I will also want to do the an LFT, especially I want to see liver function test, complete profile, coagulation profile also.
Mhm.
And I will also go for the abdominal ultrasound. And if I need, I will go for the CT.
Uh, can you just repeat your investigation? Sorry. You want to
See,
do routine labs. What else?
routine lab, except routine lab, I just told you that I will want to do the want to do the abdominal ultrasound and CT abdomen,
Mm-hmm.
and with LFT and coagulation profile also.
LFT, anything you want to specifically do in your LFT, or you will order routine LFT?
I just want to alkaline phosphatase.
Synthetic function, albumin, bilirubin, coagulation profile. I think you mentioned coagulation profile, but
Yes,
always
coagulation profile.
mention LFT with synthetic function profile, including albumin, bilirubin, and okay, what else you want to do in this patient?
I want to do the ultrasound and CT scan.
Okay, anything for the culprit organism?
Okay. I will also want to go for the HIV status of the patient.
Agree, HIV screening. Okay, what else?
The HIV screening, and then I will also go for the schistosomiasis, urine and stool examination for the ova,
Mm-hmm.
and I will also go for the blood film.
Agree, blood film, because the patient has easy bruising, so always blood
Yes.
film is important. Okay, and do you want to do anything to exclude the complication of chronic liver disease? Because he asked you, we want to travel. He have jaundice, he have distended abdomen. You didn't examine for ascites, so at least in the investigation, it's wise to say, I would like to screen the patient. I'm sorry, and if there is any ascites, I will do ascitic tab, and you can do endoscopy. What else we want to follow up as a future complication?
For the
HCC. So we can do alpha fetoprotein, right? And
yes,
as you said, the workup, the routine workup for chronic liver disease.
Mhm.
Okay. And for schistosoma, we will do serology test, microscopic examination of the stool. What, but mainly you have to mention serology testing. And we
Yes.
will go through the investigation of schistosoma, especially the one affecting the liver. What else you want, how you want to manage your patient?
I will first of all I will make multidisciplinary teams,
Mm-hmm.
gastroenterologist, infectious team, and specialist nurse and doctor, and then education and counseling about the disease, and then according to my investigations, I will treat the patient. If it turns out to be a schistosomiasis, then I will go towards the praziquantel for 3 months, and but the treatment all depends upon uh, what will be the cause of this. And I since if there is ascites, then I can do the ascitic tab, and that this ascitic tab I can send the ascitic fluid for the culture for the culture sensitivity and cytology. And according to this, I want to see whether this is exudative or this is transudative. And according to the cause, I will treat the patient.
Okay.
And if it
And before just a minute, I think before giving praziquantel, do you need to do any specific test?
I do not know.
Okay, we will check this at the end. So I agree with you about your treatment, and you have to include your patient, the full chronic liver disease treatment. You have to advise him to avoid any trauma to his tummy, avoid hepatotoxic medication. The patient is constipated, so you have to tell him that he should keep his bowel uh, loose. You have to give him some advices about travel and about driving, and you have to advise him, since you found out that there is schistosoma, that he should not go to any places where there is lakes, and he should avoid swimming there, and he should take care from the water which he's drinking, and he should avoid alcohol from now on. Even he should minimize below the, يعني, he told you I'm not drinking, but usually it's
Yes,
good to tell those people that they better avoid alcohol even socially, because some people they don't drink, but in the events they can. So alcohol is usually a regular advice in any chronic liver disease. So in case you told me you are not drinking, but it's better to avoid, even if you usually do it socially, better to avoid. So those advices, don't forget them in the management. If you didn't mention them in the closure, mention them in the management to the examiner, even though it's preferred to speak about the trigger, which is swimming in the lakes. Okay, this is very important. Now, if we will give you 2 minutes or 1 minute and a half to address the patient concern again, what will you tell this patient? Doctor, what
o-
I'm having is this bruises, something serious, and why I'm also tired the last few weeks.
okay, okay. Your concern is very well valid. If you will not take treatment, it may lead to some complications. So you have to avoid contact sports, and you will also try to regulate your bowel with some laxatives, and you will not tide yourself. Avoid,
Don't
although you are
forget
not.
that you did not tell the patient his condition yet.
Okay.
I'm assuming that the patient have no idea. He's asking you, doctor, why I'm having the bruises and why I'm tired. So before you start with the advice, you have to give the patient a clue about his diagnosis, and especially that you have some evidence from outside, so you can assume what kind of bug he's having. And let's say that you ask about the travel history and you're aware that he traveled to Africa country as a part of his charity work, and he arranged events. So you have those information. So now address the concern and start from 0 point. How you will start?
Okay, okay. If you will travel to anywhere, please please you will not swim in the fresh water,
Mhm.
and the fresh water swimming is not good for you. Number two, you will regarding the constipation, you can use your some laxatives,
Mhm.
and
Okay,
if you are but
let's say again the patient he repeat the concern. Okay, doctor, I will take those advices in consideration, but why I'm having those spontaneous bruises?
I do not know. Maybe I
Uh,
don't understand.
I cannot hear you. Just lost your
Sorry.
voice.
Hello.
Yeah, now I can hear you. So, doctor, okay, I will follow those advices, but what about the bruises that I'm having? Are they something serious? Am I having cancer? He can raise this concern. So how you will address the issue of the bruises? Because it's your main complaint from outside.
So at this stage, I cannot say with certainty, but we have to do some investigations, and after having the results, then we will be able to discussing with you.
Okay. So
But in
then
this regard,
let's say that the 5 minutes of the exam. Tell me what you want to ask Dr. Azhar.
since I did not get any points towards the malignancy, almost diet is okay, no night sweat, no lumps and bumps,
I
only.
agree with you. It's not a malignancy. So I was expecting to tell him that you are at a stage where your liver is severely damaged. And one of the liver functions is to maintain your blood, maintain your blood thin. And I mean prevent, I'm sorry, to maintain, to prevent your, to prevent bleeding by synthesizing some substances. And since your liver is failing, it's not synthesizing those substances properly, and you start to bruise easily. And this is actually evident by the yellowish discoloration, evident by the fatigue you are having, evident by the distension you are having. And also, I noticed that some organs, your liver and spleen, are enlarged. And I think this is related to your job, where because you have to travel to some areas which are endemic with some or with some kind of bug called schistosoma. But we have to confirm this by doing some blood workup, by doing some imaging, and we might need also to introduce a camera to exclude the complication of this condition. And I advise you not to travel, okay, to postpone your travel, because this will take time, and we have to make sure that you are in a good condition, okay, before traveling, and that we get everything under control, especially whenever you have a coagulopathy. So your chronic liver disease is advanced. So you have really to address the travel, you have to address the bruises, you have to address the eosinophilia, which is given to you from outside. You have, then you will tell him, yes, then you will tell him if you have some, I have some advices which we can discuss with you during your admission if you don't have time. If your time is like, you already exhausted your 2 minutes. But if you felt that you were doing well in the case, so you can give him some advices because he will be admitted anyway. So you will have time. But you have to mention that there are some advices to prevent this from progressing that we have to discuss during your admission. And we will have to admit you. So what do you think about this? Because someone who is busy and he's asking you that he want to travel, you cannot impose on him the decision of admission. You have to take his opinion and you have to involve him in the management plan. So I think your condition might need admission. So will you be able to manage this? So this is the closure which I wanted you really to manage in 2 minutes after we went through the discussion. So I
But
noticed that they have this case recently when I was reading the feedback. So I was like, try to prepare in 10, 15 minutes something about this case, even though
but
I
in
don't know how it came, but it was interesting that they brought chronic liver disease as a case of easy bruising. That what made me really interested into doing it with someone. Yeah. So this was your case,
so
Dr. Azhar.
so
No,
this was
yeah. Okay, go
Mhm.
ahead.
yes, Dr. Basa.
Yeah,
You
I
can
saw
ask.
Dr. Hind asking for a second case. Yeah, so it's still discussing, right?
Who is asking about the second? No, 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 not yet. I didn't finish.
Okay.
No, no, no. I
Okay, so
didn't.
for evaluation before moving. Okay.
La, 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 la. And I was just asking him if because he wanted to say something.
Okay, go
So
ahead. Then,
so schistosomia is basically
Mhm.
typically they are presenting with the blood in the urine or blood in the stool. There was no history like this because this is advanced case of schistosomiasis. Not only bruises.
See, you want, usually they are schistosoma mansoni and hematobium, so right? So
Yes,
it's not necessary that he will be infected by both of them. And the stage of colitis, usually, it's the earliest stage when the parasite migrate. So he might give you some history of blood and melena in the past, but he might not give you. Now your main concern is the chronic liver disease. And I would give you history of bleeding. But when I found that you wasted some times in the history of the headache, and
yes.
that it was like, start to take time, so I try to concentrate on the chronic liver disease, because obtaining that history in the past will not affect the current management. You get me? And I gave you already the eosinophilia, which is by itself a big clue for the parasitic infection. So I don't need to give you the prodromal infection, which usually happen, the catayamal fever with the colitis, and the full stage of the schistosoma. And if you would ask me about the travel, I would volunteer for you the travel and the activities in the lakes and going with the people around. And he used to enjoy his trips. So I was planning to give you all that history positive. So those are enough clue. Don't wait for the blood, which was in the past. But I agree with you. It is part, and there can be a co-infection with both Mansoni and hematopoietin. So there could be a blood. And it's not wrong, but
The patient is having 3 months. Patient is having 3 months this bruising history. In 3 months, can he develop hepatosplenomegaly to so much extent? And
see,
it is
the
and aesthetic
process of
also.
hepatosplenomegaly and its progression can be there for a long time, right? But it will not cause any complaint. It will be silent. But what started now, that he had now the bruises, and he start to have start to enter the decompensation stage. And since he's visiting those country multiple times, so he's at recurrent risk. So you might find the serology load is very high. He might have, repeated exposure. So the process of hepatosplenomegaly is something, and the acute the acute decompensation, which start to manifest by jaundice and distension, is something. Now, right? You might have palpated his liver before 6 months or 8 months. You might found them enlarged at that time. He's into this job for a long time, but not still it is in the not it's in the compensation part, the chronic liver disease, not yet in the decompensation. So why not? That he had this process since long time, just now he become decompensated.
Okay, for the investigations, only the specific is synthetic portion of the liver, albumin and coagulation profile,
The
ANR.
whole chronic liver disease workup, starting from basics, electrolyte, routine inflammatory marker, LFT, as you said, with synthetic, ultrasound, acetic tab, endoscopy, HCC, eosinophilia, liver biopsy, you will find the granuloma and fibrosis. So, but this is if it is indicated, mostly if we found the serology, the travel history, no need. But all those can be done. And here, usually we concentrate on the serology, HIV, metabolic panel, autoimmune panel. But here we will add the serology and the microscopic examination, looking for the schistosome. And the eosinophilia is already given. Let's say it was not given, then you will add this specifically in your, and the blood film. This was, do you know, if I will tell you the best thing, two things you did, that at the end you catch up that you should look for the encephalopathy and asterixis. So you ask about them, the blood film, and that you mentioned about the serology and the microscopy. So I think because you exposed to this case for the first time, but those things was really good things you did in your case.
Thank you.
But
Thank you very
don't
much. This
take
was,
time
this was
in do you know, whenever there is something like headache, malaria, you didn't take much time, even though it's a good differential here. Okay, he had it previously. He's traveling to endemic area. He is jaundiced. He have hepatosplenomegaly. So I was expecting malaria. So you didn't take too much time on malaria, rather you took time on the headache. So that's why I posted for you the image. But I excuse you because you didn't see the patient at the time when you enter, like what will happen in the case. But also you might not have a jaundiced patient. He might have hepatosplenomegaly, bilharziasis, but not yet in decompensation. Okay, so you might not find jaundice, but I expected he will be jaundiced since he have bruises. But anyway, don't waste your time too much in, especially that you found the patient have eosinophilia, bruises. So the headache is not, except if you have a
Important.
bleeding. But he told you that there is no acute changes in the headache. I agree, maybe you expected a hidden hemorrhage, but no change in the nature. So don't waste your time. Anything chronic, no change in the nature, no acute element of that chronic presentation, skip it. Okay?
And the treatment will be this praziquantel
Yes.
for
Suddenly
3
it
months.
came to my mind, Primequeen. And that one you need to check the G6PD assay. But then I'm sorry, because also in my mind was a malaria case. I'm not sure if we need to do any test before praziquantel, but this what made me ask you that question. So I'm admitting my mistake. I just mixed up between the Primequeen and the praziquantel in my mind.
Yes, yes,
So I asked
yes,
you about any test before
yes,
giving the medication.
yes.
But
You asked me,
I
but
was
I have.
hmm?
You asked me because G6 phosphate we are doing anti-malarial, but
Yes,
praziquantel,
yes. But before praziquantel, I don't think we need to do any test.
yes,
But
yes.
I'm sorry, really,
No,
for a
no, no,
second,
no, no.
I
We are
mixed up
learning.
between both things, so I asked this
No, no,
question.
we are
That's it.
learning.
Hmm?
And this praziquantel 60 milligram per kg for 3 months.
I think yes, you have to give him for a long time. Actually, I just like prepare for 15 minutes when I volunteered, so I didn't get enough information about this. Yes, yes, you are right. 60 milligram per kg per day for 6 days is
After
recommended
3 months.
for. No, no, this is not for. Wait, 3 days is recommended for Mansoni and hematopium. No, it is 40 milligram. 40 milligram per kg per day for Mansoni and hematopium. And I don't think it's for long duration because they said 3 days, at least in my notes, which is when I studied for MRCP.
Which I read,
I
which I
couldn't
have read.
really do some,
Okay, we will
research?
see.
Hmm?
But I have read it. This 60 milligram per kg, it should be given for 3 months, and we have to repeat after few weeks.
This is for
Praziquantel.
Mansoni. This is, you are right. For Mansoni, for not for Mansoni, for hematopium, the one which affect the bladder. The one which affect the bladder, usually we give the praziquantel given 4 to 6 weeks following initial exposure, but only once the diagnosis has been confirmed by serology or microscopy. Okay, then a reduced course of corticosteroid also should be given, okay, to minimize the attacks of hematuria. Praziquantel is effective in killing adult worm, although it is ineffective against immature worm or eggs. For this reason, it need to be repeated, as you said, after 6 to 12 weeks. So the course you are mentioning is for hematopium, for the one which affect the bladder. But for the Mansoni, uh, like, as I'm telling you, it's only 2 lines. For Mansoni, it is like 40 milligram per kg per day for 3 days is recommended, and you should follow up the patients over 4 to 6 weeks. I don't know how much they went deep with the candidate about the treatment, but it deserves to read about. But I'm sorry, really. I volunteered like shortly before the session, so I didn't get time really to go through it in details.
So if the examiner asks what is your diagnosis, we can say my diagnosis is schistosomiasis complicated by the chronic liver disease.
Yes, schistosomiasis in view of his risky travel to endemic area complicated by decompensated chronic liver disease, explaining the distended abdomen, the jaundice. There was a history of lethargy in this gentleman and the easy bruisability, which is a kind of coagulopathy. What is your differential diagnosis? Could be malaria, especially that is traveling repeatedly. So there is a possibility of re-exposure, right?
Yes, yes, malaria.
Yeah, this is the best. And if he asks you what is the differential diagnosis of easy bruising in chronic liver disease, because usually this is common whenever there is a presentation related to a disease. So he will ask what is the differential or what are the causes of easy bruisability in chronic liver disease. So what is your differential diagnosis?
It may be hypoalbuminemia.
Thrombocytopenia in the top.
Yes,
Thrombocytopenia.
thrombocytopenia,
Yes.
Thrombocytopenia.
coagulopathy,
Coagulopathy,
okay,
yes. Mhm.
vitamin K deficiency, because usually they are malnourished, they don't eat very well, okay. Simply could be drug induced, okay. So you will start to give the less likely causes, which is not like, very obvious in your history. Infection, recent infection, as you said, recent viral illness. So this is the differential diagnosis which you can give for easy bruising in view of his chronic liver disease. Okay. So I hope like we cover most of the things that
Yeah.
which
I
was
think
like
the good
in your
point
mind.
in this
Mhm,
case that we raised the parasitis infection, schistosomiasis
mhm,
particularly, as a refreshment point and refreshment topic. We didn't,
mhm.
I think we didn't practice this case before.
Yes, we
And
did not.
yeah,
I
exactly.
first
And
time I was doing, because I
yeah,
was thinking that in the schistosomiasis there may be bloody stool and bloody urine, but there was no such picture.
yeah. But Dr. Azhar, they will not go deep in the anti-malarial. And one word you can say if you don't know all these details, you can tell them we will start anti-malarial according to the guidelines of the infectious disease or the hospital. Because for me, I cannot remember only what I remember the artesunate in case of severe malaria or
IV
the
artesunate and IV quinine in severe malaria.
yeah, this is the severe malaria. And also there is an geographic distribution of the anti-malarial according to the organism itself or the species of malaria. So if he want to ask, if he will ask, he will go through the chronic liver disease features and complication rather than the details of the medication of anti-malaria. This
Yes,
is
I
my
think
opinion.
simply
Yeah.
praziquantel is
Yes.
perfect. Simply serology as a diagnostic workup. So for the schistosoma, and the risk factor is usually being in contact with contaminated water, lakes, swimming in fresh water in endemic areas. So he will ask about the risk, diagnosis, serology, praziquantel, and follow up with ID team. This will be very important. And also, yes, I remembered. Since malaria is your differential, so you should do thick and thin blood film. Okay, this is
In
very
serology,
important. Yes.
in serology of schistosomiasis, which test we are going to do?
See, I kept in my notes the serology test is a diagnosis is made by microscopic identification of characteristic egg in the stool, urine, or sputum. This is
Yes.
early. Or
Sputum,
identification of
stool
the
and urine.
larva or
Okay.
adult worm in the tissue. تمام? So
Clean.
biopsy might be important. Serology available for some trematode infection may be more sensitive than microscopic examination, especially during acute infection. So you will tell just microscopic examination from the secretions of the body, whether urine, whether stool, whether sputum, and serology test, as simple as that.
There is also one more test they are doing, circulating cathodic antigen in schistosomiasis.
Whatever you will remember, mention it. Antigen and serology cover antigen and antibody. Serology
But
is
the
a
blood
very,
film,
very good term for both. Usually, when you do serology, it is either antigen titer or antibody titer.
yeah, but
Absolutely,
again,
antigen level and antibody titer. So when you mention serology, it covers both. When we do hepatitis serology, it is S antigen and S antibody. So you do both,
but
right?
the blood film is the most important to do.
Blood
This is
film and thin and
yeah,
thick,
thick and thick.
thin and
Yes,
thick blood
exactly.
film. Blood
Yeah.
film because you might see the stages of the parasite in the blood, whether
Exactly.
for malaria or for schistosoma. The tissue samples, if indicated, plus serology, plus microscopy. You cover all the parasitic infections, then the chronic liver disease workup, okay? Then the future follow-up for complication, which is endoscopy, alpha-fetoprotein, and regular follow-up by ultrasound.
Scan, yes. And we will not forget also the acute malaria presentation. Parasitic patient came.
Hemolysis, yes, hemolysis. So you can add the hemolytic workup since he is jaundiced. But see, يعني, try to give a priority. Since he really have the chronic liver disease and everything, so try to concentrate on the chronic liver disease, schistosoma, then the malaria workup as a differential.
Exactly,
So
but
whatever you remember, hemolytic workup, thin and thick blood film, all those things.
I'm refreshing our knowledge about
You mean
yes, acute confusion
as
by
general, if it
malaria.
is a case
Yeah,
of malaria.
yes,
Okay.
as a malaria case, yes. So
But
because
Dr.
we already,
Bassem,
yes,
malaria is acute life-threatening infection. So I don't think chronic hepatosplenomegaly because of malaria. This is out of differential. No patient will survive if has severe. I don't think so. And usually isolated splenomegaly, not with hepatomegaly. There's nothing named chronic malaria. This is acute infection. So it's
I,
not in
it's
differential.
no, it's not a malaria. This is schistosomiasis.
Yeah. I mean, I cannot put malaria in differential diagnosis. This is
He's
acute infection.
already,
No, no,
Need
no.
urgent treatment.
he's still traveling and he's telling you, I will travel after 3 days. And if you
Yes.
ask him when he was last time been in Africa, he will tell you before, for example, 4 weeks or 3 weeks.
So it will be hemolytic anemia. Where is the hemolytic anemia apart from the jaundice? If you have hepatosplenomegaly.
You are giving a differential.
Yeah.
Your
But
differential is less likely to fit the presentation. This is something يعني هذا أمر مفروغ منه إنه دائما الديفرنشال كوني أنا حطيته second أو third differential for sure it's not fitting the full, but is it a good differential? Is it
بس
a good
الملاريا
thing to exclude?
بعيدة خالص. الملاريا بعيدة خالص عن الديفرنشال diagnosis. الملاريا ما بتعملش no chronic liver disease. الملاريا.
Yes,
But
as acute only, Dr. Ahmed. Yes,
presence
you're
of
right.
xenophilia, doctor. Xenophilia in the scenario.
Even if
Yes, sir.
eosinophilia in the patient that didn't came with hemolytic anemia, this is not
So
a
you will
malaria.
put parasitic infections.
So,
يعني
صح؟
أنا قصدي إذا واحد عنده chronic liver disease من الشيستوزوما وسافر ولقط له ملاريا،
No,
حدا
but
بيمنع
please,
الملاريا إنها تفوت على جسمه؟ لا، عادي يعني ممكن يجي on top of the chronic
أيوة
liver disease
yeah,
very
but
ملاريا ويتعالج
make the
منها يعني.
discussion, Dr. Ahmed, please make the discussion in English because Dr. Azhar is the one participant with us and he's
okay.
okay.
So
Yeah, if you want to
it's
discuss,
very
please.
very unusual.
I agree with you, it's very unusual, but try to keep some differential in your mind for the case. What came in my mind, malaria is a good one, hemolysis is a good one, drug-induced bruises could be, and the other causes of chronic liver disease.
I mean, eosinophilia will not change the differential. So if you have chronic liver disease, I think you have to put alcohol again, autoimmune, metabolic, drug-induced, and viral.
You know, Dr. Ahmed, when I start the case, when I read the case, you know the first definition what I put? Cushing
What?
syndrome. Because Cushing, there is easy bruises with eosinophilia. But the case came as different totally.
Plus the image we share in the group, it's a blue eye. So blue eye with easy bruises, this is Ehlers-Danlos syndrome.
blue eye يا
Yes.
جماعة، blue eye والله وحياتكم هي جوندس. فين البلو اي؟
عشان احنا بصينا
الزلمة عيونه زرق يعني.
كورنيا.
الزلمة اسمه آدم سميث عادي يكون عيونه زرق.
عيونه زرق. ايوه
نحن وي كونسيرن على اللينسز، المفروض الاسكليرة هي اللي بتكون بلو في الإهلر-دالوس.
Yes, Dr. Hind, if you see there's a blue sclera, and I was also thinking about this Ehlers-Danlos syndrome, Marfan
Even
syndrome.
Guys,
Because
his iris is blue, not his.
yes, iris is blue. Iris is blue. So
Yes.
I was also thinking about on this, and then at the end I saw there is a jaundice, and the patient you told me
Do you know
hepatosplenomegaly.
that's why I posted for you the image, but despite I posted the image, I will tell you that I could notice in your history you were going with the usual easy bruising scenario which we have, which is ITP, Ehlers-Danlos syndrome, steroid induced. So I noticed this in your questions actually. That's why when I found you taking more time in the headache, I posted the image because I wanted to drag you away from the easy bruising of those diseases. But still, we cannot deny that easy bruises is a very important symptom in chronic liver disease. And it is one of the differential which we should exclude. And to be honest, I would never have the courage to bring such case if I didn't see this in the in the experience, because usually there is a myriad of presentation of chronic liver disease other than having just easy bruising. Really, it dragged my attention that it was written easy bruising, huge spleen, history of bilharzia. So it يعني I couldn't bring the case in a way other than this, and it will remind us with easy bruising for chronic liver disease as a complication.
Uh, yes, it is a good case, but again, so the positive finding in this case, maybe apart from the history, because it was not taken properly. So the positive cases we have now here that he has eosinophilia, this is number one, and he has easy bruising as a complication of the liver disease, and he has hepatosplenomegaly. So it is hepatosplenomegaly plus eosinophilia. This is the main things. Eosinophilia per se can be a result of many diseases. One of them is the chronic myeloid leukemia, acute ALL also can cause it, in addition to other malignancies. It is very known that eosinophilia can be found in malignancies. So again, here with we will forget about the bruises because the bruises is secondary to the chronic liver disease. So what we found here in the patient, hepatosplenomegaly. So the proper differential for me when I tell the examiner, I will tell about my differential diagnosis for this hepatospleen, for the jaundice that it is probably from the liver disease, and for the hepatosplenomegaly, I will mention infection, malignancy, hematological, and infiltration, sarcoidosis, like that, okay? So all these causes can cause, and again, also in the hematological, the what extra medullary erythropoiesis also can cause
Just
hepatomegaly
one
and
minute,
splenomegaly.
just 1 minute. What will differentiate between your list of differential diagnosis, which is anyone will mention for you? What is the difference of chronic liver disease? He will list all those, and a
Yes,
person who took a history,
the history
simply
will be
one word, the
differential.
risk
Yeah.
factor.
For that
And
reason,
if
I
I
told
gave
that
you risk
about the
factor,
history.
you cannot
Yes,
list the
that's
12
what I
differential diagnosis of chronic
doctor,
liver disease,
doc,
ignoring the risk factor اللي أنا أعطيتك إياها positive.
doctor, regarding the history, maybe what I started with is that the history was not took properly. So it was only history that he worked like that, and this for 2 and 3 months, okay? And he has this hepatosplenomegaly. If the history was very clear, taken that it is like that from here, from infection, from
We should do the case based on a clear history. نحن we will not do the case based on vague history. And when I told him to again give me the differential, I already clarify about the travel history, about the risk factor to the endemic
about
area,
malaria.
and there
no,
was a past history. So I was very clear before I asked him again, and I told him what expected bug. So I cannot
but
accept
in the
some differential
in
like
the
autoimmune chronic liver disease in such a case.
okay, in the differential, you cannot ignore the other causes of hepatosplenomegaly, okay, and put again malaria as a differential here. It is completely inappropriate for the examiner. He wants differential of hepatosplenomegaly. After that, he will take the infection. Okay, you mentioned infection, one of the differential. So if we think that this patient has, for example, schistosomes, and he will take you for that. Just only, I mean that the differential should include the causes of hepatosplenomegaly.
Doctor, I have one question. If this patient has a stigmata of chronic liver disease, I should put this in the top of my differential. Then I will put lymphoproliferative and
No,
leukemia
doctor.
and myeloid.
Once she mentions that the bruises is secondary to the liver disease for chronic schistosomes, that means she meant that this patient has chronic liver disease.
But I'm asking in the examination, there is any stigmata of chronic liver disease?
Can be dilated
no?
veins. Can be
There
dilated
So I
was
will put
palmar erythema. You may not find them all, but you can find some of them. The ascites, it is a sign of decompensated liver disease. The palmar erythema also is part of that. The easy bruising, if we tell that the easy bruising due to synthetic abnormality
even
of the liver disease, all
when I
these
ask
are
Dr.
So my top
pointing.
of my
about
differential,
the malignancy, about
it
the
will be chronic
malignancy
liver
as
disease
a
by
concern.
all the causes. Another, I will
Yes,
put
exactly,
malignancy.
exactly.
Yeah, please, guys, we are here to learn from the cases. The point of differential, how to do differential, how to get the lesson from the condition and the case. No argument about the differential here. The point here just refreshing the point of malaria, refreshing the point of schistosomiasis, which can be raised in the exam. You don't know what the case will be in the exam.
Yes, doctor,
Anyway,
but just I
yeah.
will tell something regarding the
Doctor,
examination.
actually, excuse me.
Okay,
Excuse me.
I will
Actually,
just ask Dr.
I
Azhar,
think it's a
please.
typical case. If we remember that, I mean, in endemic areas of schistosomiasis
Yeah,
and
that's it. Yes,
hepatosplenomegaly and portal hypertension, this is a typical case of presentation of
exactly.
chronic
So you can put it in
schistosomiasis
the
with
differential.
reported fibrosis. So I think it's very interesting case and very good case presented by both Dr. Azhar and Dr.
Yes, exactly. Yeah,
And
this is what
actually, the
we.
malaria can be, although it's like maybe 3 months, but or 3 weeks. So it can be like a chronic malaria or plasmodium ovale, plasmodium vivax patient can be carrier. So the important take-home message here when we take this test. So what we miss in the history, I think maybe as she said, the traveling history in details, blood transfusion, in any case with liver disease, we should ask his sexual history, we should ask an alcohol history. And then patient is decompensated. Why he decompensated? Then the triggering factor, of course, we already know is the constipation, dehydration, anemia, any electrolyte imbalance, any recent infections. And then
Yes.
in the differential diagnosis, when she talked about the xenophilia, other other parasitic infections included as other than the schistosomiasis, we can also include visceral leishmaniasis. We can also include hydatid cyst, hydatid disease also, but it's a little bit complicated case for hydatid disease. Also present with eosinophilia and liver disease. So
It's fair enough to say protozoal
برز
or parasite infection. It's fair enough. To be specified the
ليش؟
infection.
لأنه بس
usually given in acute cases.
الليشمانيا have endemic areas other than Africa.
Yes, exactly.
But
So
just
you
in
can't.
here there was no
In
skin
Africa and
lesion.
India also.
بس guys يعني I think the differential diagnosis will be directed by the examiner. If he asks,
Exactly.
like I asked Dr. Azhar, what is your differential diagnosis of easy bruising in chronic liver disease? He will give me differential. If I ask him, what is the differential diagnosis of hepatosplenomegaly? He can list the 12 differential. If I told him, what is the differential diagnosis of hepatosplenomegaly in this patient? So he should take in account the risk factors and rearrange his differential. The question is the key. It's not
This is
something
the take home
open for
message.
us.
Yeah.
He will not tell you like what is
And
written in the table. In the table, it's written
agree.
differential diagnosis, the skill number E. This is not the case. In the exam, the examiner is concerned about differential diagnosis, particular differential, either related to the complaint or related to the final result
But
which you came with, which is the chronic liver disease. So he will be very clear when he will ask you the question. And
Yeah,
believe
and
me, you will يعني you have to listen to the question rather than considering your differential diagnosis, which was outside differential diagnosis, which is depending on the eosinophilia. All those will not help. What will help is to listen very well to the examiner question and give the differential diagnosis targeted to that question. It can be many questions. Differential diagnosis of easy bruising in general. Then we will tell about the malignancy, or differential diagnosis, like as you said, hematological malignancy, lymphoproliferative, myeloproliferative, hypersplenism, pancytopenia,
and
whatsoever
this is
can come to your mind,
yes.
hemolysis, anything, infection, viral, or he can ask you about easy bruising in chronic liver disease.
And this is the difference between short station or abdominal station and the long case with hepatosplenomegaly. Because there you cannot take history and you can put all this differential. But when you take history, you will focus on certain
Yes, I
points in the
agree with
history,
you. فمتعودين
travel,
نحن على ستة
endemic.
12
Yes,
differential.
exactly.
It work
Yes,
very well بالexamination. صح كلامك. I agree with you totally. No, there is no history to guide me, so I have to list all the differential. But here, I took already, I examined, I have a lot of risk factor which should guide me. طيب this is the table I will post for you. يعني أنا حاولت قد ما بقدر بأقصر وقت إنه to collect for you a good calibration for the case, especially that it came newly. And Dr. Azhar, please, analysis of the symptom, because you did the case and I want you to get benefit from it. Analysis of easy bruising was not complete. Trauma, okay, pallor, because usually easy bruising is a kind of bleeding. So you should ask me about all the symptoms of bleeding. Okay? I like that if you consider headache as a hidden bleeding, it's perfect. Usually we forget the hidden bleeding, bleeding in the retina, bleeding in the brain, retroperitoneal bleeding. So all those are good things to consider whenever we think about bleeding, along with gum bleeding, nasal bleeding, under the skin, if she was a lady, menorrhagia. Okay? You have to ask whether you have to dig slightly about the trauma, spontaneous, the severity of trauma, painful bruises or not. Are they painful? Because if they are painful, you will think about vasculitis, okay? Not platelets disease. So whether it's pain or not, associated with anemia or not, okay? These things are missed from you. Usually easy bruising analysis is not the usual, like there's no timing, there's no increase, decrease, okay? There's not much to ask. You get me? So you have to remember the special analysis for easy bruising. And in the
yes.
examination,
I guess the analysis of easy bruising here will be for the association and for the differential, because easy bruising means either by minor trauma or even without trauma. So
yes,
nothing,
and
yeah, will,
it is a
yes.
bleeding symptom. So you
Yeah,
have to
so I
include
will jump
anemia
to
in your
the
red flag.
differential.
Mm.
Yeah, I will jump to the differential to get the question targeted the differential. Why this is here, and I will go
بالsystemic
through.
review I agree with you. يعني انت بعد ما خلص always never ever miss يعني I agree with you. هون في عنا شعور انه انا عندي chronic liver disease فليه ضيع وقتي، لكن as a part of the communication it's only as simple as trauma without trauma, a distribution of the bruising, painful ولا لا، في معها anemia ولا لا، و exactly if there is bleeding elsewhere. هنا الخمسة ست أسئلة. Don't waste your time about what increase it, what decrease it, will duration worsening ولا،
Yeah,
then
yes,
it will not
agree.
make difference. لكن هدول will make difference. تمام؟ Because I might go with vasculitis if it is painful. You get me? يعني it will even, this kind of analysis will really help you. يعني إذا لقيت other bleeding symptom، إذا كانت painful، إذا كانت induced by trauma، إذا كانت spontaneous. So all those things will really help you. So don't give up on the specific analysis of the symptom because you found jaundice and distended abdomen. They will cut your marks in the communication. I agree you
Yes.
will get the full marks in the differential because you excluded the differential in your history. But the part related to the analysis of the symptom will be affected يعني. تمام؟ So you might take for example borderline. So always analyze the symptom very well. And Dr. Azhar, your symptoms is easy bruising. I was expecting the first thing to do, show me where are your bruises. يا ترى هنن ecchymosis هنن vasculitis مثل ما as we agreed, small, big, petechiae, what they are, right? Distribution, traumatic area ولا non-traumatic area. So always remember to check your main complaint first. تمام؟ Chronic liver disease stigmata, as you said, asterixis, pulmonary erythema, the spider nevi. I told you no spider nevi in the chest. I was really willing that you will tell me, okay, sit please. I want to check them in the back. Volume status, volume status of the patient. You have a distended abdomen. So ascites, bibasal, crackles, JVP, lower limb edema. Always in the chronic liver disease, chronic kidney disease, volume status, plus the red flags, which is encephalopathy in chronic liver disease and uremic encephalopathy and other indication of dialysis in chronic kidney disease. فتake care of those. يعني blood pressure sitting standing I wanted you to do. I gave you a borderline blood pressure. Okay, so blood pressure sitting standing, this was an important step. Chronic liver disease stigmata, including the red flags, volume status, check the bruises. تمام. So يعني only those points, because I kept this at the end just to remind you with those small bits and pieces here and there. Not to mention بقى risk factors, the vaccination, always ال ITP with TTP are induced by vaccination. The patients usually take flu because he's traveling to endemic area. He might receive the recent vaccination, as simple as that. And your ITP is only vaccination related as a trigger. So vaccination, bloodborne viruses, risk factors, travel, okay, detailed history about contact. So those things also was missed. And they will help you in arranging your differential. Otherwise, يعني I enjoyed practicing with you, يعني. Really, thanks for taking the
Yeah,
time.
I think it was a bit great. He reached to diagnosis. It was a difficult case for all of us. So let's move to the next scenario. Please, Dr. Azhar, can you post the scenario
I
in the
want to
chat
ask
box?
you, Dr. one thing. As you
Yeah,
told,
sure.
you have to advise him do not travel. If the patient says it is very urgent, so we can say you can travel, but you should not go to the freshwater swimming lakes. Can we say
No,
like this?
Dr. Azhar, you are not the one who will tell him whether he can travel or not. There is a MDT. So I would say if he told me it is urgent and I cannot miss that event, I have 3 days, right? How many days you have? I have 3 days. Okay, I will document and I will make sure that everyone is informed about how much it's urgent for you to be managed. Okay, and we will try to assess you as early as possible and inform you about your fitness to travel and what are the risks that you have to monitor yourself for or you are exposing yourself for if you travel. Okay? What if you find the big varices and they are about to bleed in your endoscopy, right? What if you found that the coagulation profile need correction by some urgent fresh frozen plasma ولا cryoglobulin ولا whatsoever. So all those are not yet available. All those information are not yet available. But still you have 3 days and you can do a lot in these 3 days, you and your team. So if he told me it's urgent and he didn't agree to postpone, I will offer him someone to cover him in the event. No, doctor, it's only me. I know everything about the event. There's no time to give these tasks to anyone. Okay, I will make sure that everyone is aware. We will try to do everything on an urgent basis and we will come back to you and inform you about the risk you are exposing yourself to if you travel and what you have to monitor yourself for and what are the warning signs which should make you seek an urgent medical attention in the country where you are traveling to. Not to mention that please try to not to re-expose to the fresh water because this is the trigger of your whole condition. That's it. So this is how you will address it in as short as possible, but at the same time as safest as possible. Okay?
Yes. Okay.
But please don't give a final decision at all. Never say yes you can or no you cannot. 3 days are enough for you to decide, involve the MDT. There is risk, but he will be aware about those risks. It's up to him. He accept them or not. Okay?
Okay. Yeah, thank you, Dr. Suhail. Good case and good advices and good approach with good management plan and investigation and everything as a differential as well. Your case here, you can see in the chat box. Okay.
بس
Yeah.
wait a minute.
It's Mr. Andy, 19 years, present with learning difficulties. His blood pressure 170 over 100. Rest is normal. Rest of vitals.
مين اللي حيعطي الكيس؟
دكتور أزهر.
دكتور أزهر. دكتور أزهر, you picked for me learning disability. What a punishment for me.
No, it's a good case. You will
Learning?
read.
I was just telling you about the analysis. Now you will put me
No. If you
in a
don't want to
victim.
do,
No. Wait. We are learning. But يعني I have to tell you this that really it's difficult. بس خلاص at least يعني I'm sure that there is some
inshallah, you will do
good
it. I
learning
do.
points, yes, from the
You have,
case.
mashallah, very good knowledge, and you can do it.
Let's see if we can do it.
And I will help you in between.
Thank you so much. I really need it.
No.
19
Dr. Rahim,
No, you
years,
can do it,
and
Dr.
do
present
this
with
for
learning
me.
difficulty.
First time I did this case. First time I listened this case, and I learned a lot.
Yeah, that's why I told you it's really, I know that those rare symptoms with difficult analysis, they teach you really a lot. They teach you a lot. Okay,
Because
so
in the beginning I was thinking it may be ITP, it may be some viral, it may be some drugs. But at the end, when I saw the picture, I saw the picture. Roundabout when the 13 minutes finished, I saw the picture. The patient is jaundice, maybe hepatosplenomegaly, maybe he's having schistosomiasis.
to be honest, easy bruising is not the best to be present with, but since it came in the exam, it's good to keep it in our mind.
Okay.
Okay, so just the 3 minutes, I will prepare
Yeah,
the
yeah, yeah.
case.
Okay. Let me know when you are ready.
وهذه كده كده شنو هيكون
Ready, Dr. Rehan?
Yes, ready. Okay. Dr. Azhar,
Okay.
are you there?
Yes,
Here you
yes,
go.
I'm here.
Okay. Hello there. I'm Dr. Murad, the doctor on duty today. Can I please confirm your name and age?
My name is Andy. I'm 19 years old.
Okay, Andy, how do you want me to call you? How do you want me to address you?
Andy.
Okay, I'm here today to examine you and ask you some question. Are you okay with this?
Yes.
Okay, Andy, can you please tell me what brought you here today?
Doctor, I have learning difficulties, learning problems.
Okay, can you please describe this learning difficulty? Did you encounter those at early classes or it's just a recent problem?
I'm having these problems since my childhood.
Since your childhood. So and how much did you achieve of your school until now?
Only up to class 7.
Class 7, okay. And do you have any similar family history, like your siblings, anyone in your family has the same problem?
I do not know because I'm adopted.
You are adopted, okay. And you don't know anything about your biological parents or siblings?
No, I do not know.
Okay. And just a routine question. Do you feel that you are shorter than your colleagues in the school?
Yes, yes.
Okay. And if you don't mind, I will ask I will offer getting the parameters. Okay. So to see if there is any proportionate or disproportionate short stature. So what is this case?
I think I'm really shorter than my age colleagues.
Okay, but I will try to measure if there is a measure tape or anything. So at the end, if I measure, is he proportionate or not?
It's not proportional.
He is not proportionate. Okay. And then I will try. Can you please post an image because I am expecting now that there is a dysmorphic feature or he have normal face.
Sorry, at this time I don't have picture.
Okay, can you describe for me like that? Does he have frontal pausing, short fingers,
The front
whipped neck?
web neck, yes.
He have whipped neck, Mr. Andy.
Yeah,
Okay.
yeah, yes. Yeah, he's having web neck.
And short hairline, what we say, like low slanting ears, those things.
Yes, yes,
Okay,
yes, yes.
so then I will ask him. You told me there is no family history, right? He's adopted.
Because I do not know I'm
Yes.
adopted.
Yes. And can you please, can you, Andy, please tell me whether you achieve the pubertal age at time? Like, are you shaving frequently? Did your voice change?
No, 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 no,
You didn't have those signs of puberty like
no.
your peers.
No.
Okay. Um, okay. Can you please tell me if you have any weight gain or weight loss, any kind of weight changes?
No,
Okay. Do you have any enlargement of your breast?
no,
Are you engaged in any intimate relationship at this age? I'm sorry to ask this.
no,
No. Okay. I will also ask this patient, do you have any change, any recent infection or recurrent infection during your childhood?
no,
Okay. Have you been admitted to the hospital? Any blood transfusion?
no,
Any surgery or procedure?
no,
Any past medical history I should be aware of?
no,
Have you ever been in an area where there is high radiation load, like near factories or something like this?
no.
No. Uh, how is your diet? Are you getting uh, a good diet containing all
Normal,
elements?
normal diet I'm taking.
Normal diet. Okay. And your weight is stable. There is no loss of weight, as you told
There's
me,
no.
right?
Yes, yes.
Even before, as a child, I mean.
No, no,
Okay. Have you ever noticed any skin rash,
no,
any joint pain?
no,
No? Okay. Do you have any, did anyone notice that you are paler than usual or yellowish discoloration of your eyes? Any kind of
Ye-
changes like this?
Yes, yes.
What, are you pale or like, do you notice yellowish discoloration?
Paler.
You
Now,
have,
about the rash, I just want to tell you I have a rash. I will post you in the group. You can see rash.
okay. And I would like also to know the distribution of rash. So this rash that I will see just now, which areas are involved?
Mostly it is in the back.
Mostly it is in the back. Okay.
I send you the picture of the rash.
I'm waiting. Okay. Um, are you on any regular medication?
No,
Okay. And do you take any over-the-counter medication?
no, I'm not taking any medicine.
I'm sorry to ask this question. Any recreational drug or sharing needles?
No,
Okay. And this rash that you are showing to me, is it since birth?
no, it is from 2 years. I'm having this rash.
Okay, 2 years. And it's only covering your back, right?
More on the back and a little bit on my front.
Okay.
Have you seen the rash?
Is it sensitive to the sun?
No,
Okay. And is it itchy?
no,
Okay. And do you have any other kind of rash different than
no,
this?
no,
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 only
no,
this
only
kind
this.
of rash. Okay. And yes, I need to ask you, did you travel anywhere?
No,
No. Do you have any contact with sick or ill person?
no.
Do you smoke?
I usually smoke 10 cigarettes per day.
Okay, smoking is hazardous to the health. So I would really prefer if you stop smoking and we can help you through our smoking cessation clinic. And do you drink alcohol?
No,
Okay. Um, okay. Do you have any headache or vision problem?
no,
Sure. Do you have any weakness or abnormal sensation anywhere in your body?
no.
Okay. Do you have any kind of hearing loss?
Yes, I have also hearing problem also.
Hearing problem. Okay. Since when you have this hearing problem?
It is around about 10 years.
10 years. Okay. And both ears or one ear?
Both here.
Both. Are you using any hearing aids or how you are managing?
No, I'm not using any hair hearing. I did not take any proper treatment about it.
Okay. And do you think that hearing is the problem behind your poor achievement in the school, or they are providing you with visual aids, visual assessment tools, so to compensate for your hearing problem?
Yes, yes, I'm thinking that this hearing also it is adding in my problem, in my poor performance.
Okay. Did you notice any kind of imbalance, repeated falls?
No,
Okay. Do you have any chest pain or awareness of your heartbeat?
sometimes I have noticed that my heart is racing.
Sometimes your heart is okay. No vision problem, no bumping into object, no blurriness.
No,
No. Okay, so can you tell me about the awareness of your heartbeat? Since when?
uh, it is also from 10 years.
10 years. Okay. And did you ever get investigated for this?
No,
Okay. Do you have any chest pain, any loss of
no,
consciousness?
no,
No. Do you have any swelling anywhere in your body?
no,
Okay. Do you have any kind of problem in your tummy,
no,
tummy pain, distension, any bowel habit changes, loose, hard motions,
no,
heartburn,
no,
any kind of changes in your nose,
no,
recurrent sinusitis, recurrent ear infection?
no,
No. Okay. Do you have any problem in your water work?
No,
Um, any repeated stone formation,
no,
any kind of, okay, blood in your waterwork, no. Do you have any cough or cough blood?
no, never ever.
Okay. Do you have any problem with your bleeding anywhere, bleeding from your nose under the skin?
No,
No. And you told me no joint pain, back pain, neck pain, maybe?
no, no,
Any muscle cramps?
no,
Any weakness when standing from sitting position?
no,
Any increased water work or increased thirst?
no problem in my water.
Okay. Uh, طيب, can I examine you?
Yes.
I would like to check the rash. I will see if it is plungeable or not, painful or not, raising above the skin. I will try to see the distribution, whether there is a loss of sensation over it, anything which can guide me with this type of, I don't know
It,
really what is this type of rash anyway.
it
And
is not
then,
blanchable. It is not blanchable. It is not painful. It's not oozing. It is
uh,
not have any problem with the sunlight.
okay, now I will go to examine his hearing. I will offer Whipper and Renee, but I will do the brief hearing by whispering in his ears. So is it sensory neural or is it is conductive? At least I might perform Whipper. Since he's
Uh,
not hearing in both, it will not help me. Anyway, I will try to whisper. He cannot hear.
it, no, he cannot hear.
Then I will examine the cranial nerves above and one cranial nerve below. So I would check the trigeminal, the sensation over V1, V2, V3.
Normal.
Normal. I will ask him to smile. Any deviation?
No.
No.
Normal.
I will go for نسيت شو بتعمل. طيب I will ask him to close to squeeze my hand and shrug his shoulders, abduct his shoulders. I'm sorry. Any proximal weakness, distal weakness?
No.
No. He told me he have awareness of his heartbeat, so I will examine his heart. I will locate the apex, and I will listen to the heart sound. And if there is any murmurs, anything,
There's a pulmonary stenosis murmur.
pulmonary stenosis. Okay. And I will ask him to inspirate and expirate to see if it is increasing or decreasing. And there is one thing I wanted to do. Yes, you told me there is whipped neck. So I will examine if there is a shielded chest, whipped neck, the ears,
Yeah.
the
Yes. Yes.
fingers, all
Yes.
those.
Yes.
Okay. Are there. Okay. And then I wanted to examine his abdomen, any organomegaly, any palatable kidney. Yes, Mr. Andy, I noticed that you're hypertensive. So can you please tell me if you had similar readings in the past?
Yes. Yes. For many years, I'm having this
And
problem.
are you on any medication for this?
No, I am not taking any medicine.
Okay. Now I would ask Mr. Andy to, no palatable kidney, right? No renal per week.
No.
Okay. Then I will ask Mr. Andy if there is any, I did the abdomen.
2 minutes left.
Hearing.
About the hearing, you asked me, is sensory neural hearing loss.
I would really appreciate if the examiner could help me, or I will do the whipper. Any lower limb edema?
No.
Any nail
No.
changes?
No. No.
No. Okay. What else I want to do in this gentleman? طيب, what is your concern, Mr. Andy?
What do we have? Why I am having this learning difficulties and hearing problems since my childhood? Why I'm having these problems? And why I'm having this rash?
See, it's very difficult in this short time to tell you about the exact cause, but since you have it from your childhood and since you notice that you're also shorter than your peers and you have this hearing problem, rash, and awareness of your heartbeat, and also I noticed there's a problem in your heart. So I'm thinking there is a kind of genetic disorder. I mean by genetic disorder, some problem in your codes. Those codes usually run from one generation to another. and are responsible for, if they are faulty genes, they can lead to the symptoms that you have. And they can be part of familial disease, but since you are adopted, it's difficult for us to determine if you got this from your family. At the moment, I might need to involve a genetist and a group of doctors to assess your heart, your skin problem, to assess your learning ability, to try to provide you with hearing aid, okay, to make your problem, to make your learning process easier. And we will also come back to you and update you about the results of the workup and whether we were able to confirm this possibility or whether there are other differentials also. But most probably it's a kind of codes problem. Do you have any, do you drive?
No,
Mm-hmm.
Okay, time
And
is up.
with whom you are living?
I'm
Time,
living with my
time is up.
Yeah, time is up.
although I'm adopted, but I'm living with parents and sister and brother.
Just I would ask if they are supportive, because if they are not, we can offer you the proper support. Okay, I'm done.
Okay, examiner
Okay.
question, Dr. Azhar, please.
Now please present your case.
Um, I'm having a patient who is 90-year-old, Mr. Andy. He's having a learning disability since a childhood. He's adopted, so the family history is not well clear for us. He have some dysmorphic features, which can be consistent with Noonan syndrome, and he have short stature, whip neck, what we say also, there is this morphology in his ear, in his eyes, whatever I could elicit, short hairline, shielded chest, all those things I will mention them as a part of Noonan. I would able to elicit some systemic manifestation in the form of hypertension, which could be due to anomaly in the kidney. He has also hearing disability, sensory neural. He have pulmonary stenosis and palpitation. He has also some kinds of rash, okay, which could be a kind of nevi or lentigo or melanoma. I really don't know. I would really need a derma specialist to help me. And also I could find that he's pale, so there might be some kind of anemia going on. Could be part of the renal disease or something else. I would like to examine his thyroid. Usually they have endocrine disorders. And also I would like to offer gonadal examination. That's it.
Okay. What would be the gonadal?
What would be what?
What would be in the gonadal examination?
Do you know, he told me he didn't achieve the pubertal,
Puberty.
the secondary
Yes,
sexual
puberty.
characteristics were not there. So I'm
Puber-
expecting gonadal atrophy, some
Undescended testis.
sperms issues. What?
Un- Undescended testis. Okay.
Undescended testis, really, yes,
Okay.
okay.
What is the reason why I'm having high blood pressure?
I remember Noonan syndrome usually have horseshoe kidney or some kind of anomaly in the kidneys. So this can precipitate hypertension, or it can be part of secondary hypertension
It can
syndromes,
be due to pulmonary
RAS
stenosis.
or renal art. What?
Maybe due to pulmonary stenosis.
Pulmonary stenosis and hypertension.
Okay.
Maybe.
In the hand, I have a single palmar crease. Do I have Turner syndrome?
See, Mr. Andy, you have a feature which can be similar to a syndrome called Turner, but Turner is usually happen only on females. It's never
Okay.
affect males. Whenever we find those feature in a male, we think of a different syndrome, which is a kind of a familial disease called Noonan.
Okay. Why I have single palmar crease in my hand?
Single palmar crease, Down syndrome. There's usually single palmar simian crease is down. It could be part of the genetic disease you have. I would really tell him that this is beyond my specialty and it could be part of his genetic disease, but the genetist will be in a better position to address this concern.
Why I'm having rash?
Mm, see, the rash is it could be also, I will tell him that it could be part of your genetic disease. The dermatologist will
How
be
will
a
you
better
investigate?
position to address this concern.
Yeah, and how will you investigate?
How I will investigate, Dr. Azhar? Okay, I will first really involve a genetist and concentrate on the genetic testing, and then I will start to investigate one by one the hearing by audiometry, the rash by the help of dermatologists. They might really find out something. I would investigate the cardiac problem by the help of ECG, chest X-ray, echo, and involve a cardiologist. And I would do a Holter monitor, all those workup to find out. I will do extended electrolyte profile, TFT, to find out why he have palpitation. So all those, I will put them under the cardiac issue. For the abdominal problem, the hypertension, I would do the aldosterone renin ratio. I will do the uh, you can say lipid profile if it is some kind of metabolic disease. I will do for him ultrasound of the kidney to see if there is any renal anomaly. I will do for him any end organ damage workup, anything related, urine analysis, those things. So the hypertension, the cardiac issue, the rash, the hearing, the learning disability, I will involve the specialized team in learning problems to find out whether it is related to his hearing problem or to the underlying genetic disease, and they can offer him the proper support. And also he has pallor, so I will do the full anemia workup, vitamin B12, folate, hemolytic workup, all those things to find out blood film, to find out why he have this pallor. I will do hormonal study. Oh my God, hormonal study for the gonadal hormones, for the thyroid hormone, for diabetes, all those endocrine diseases which is common in this genetic disorder. I will maybe pituitary because it's also short stature, so it can be a part of differential diagnosis. This is my workup.
Okay, transfer this my disease to my children?
Yes, I think.
How much is the percentage?
See, it is, I think, autosomal recessive, so the percentage will be 25%.
And what will the differential diagnosis in this case?
Differential diagnosis will be Down syndrome. Okay. Will be some, I don't know, but I would only keep Down syndrome.
No, you are right. Down and Turner, you are right. Down Turner syndrome.
But
Okay,
he's a male, so I would think 100 times before I will mention
yes.
Turner.
You can say he is a male. So Turner is always in female. So
Yes.
how will you manage?
How I will manage? See, I will. Okay, I will address one by one according to his problem. So I will manage the risky things first. So I will address his cardiac issue. I will address his hearing issue by the help of hearing
You
rehab.
will make multidisciplinary team.
Multidisciplinary team, yes. And I will educate him and counsel him, and we can do some family planning for him because this disease can be transmitted. So he need to have some counseling for future family planning. I will give him some replacement for the deficient hormone. I will screen him for osteoporosis if he don't have any testosterone. So this will be very important. And I will refer him to fertility clinic, to learning
Do you
disability
go
team,
for the
cardio clinic.
chromosomal analysis for this patient?
No, chromosomal for Turner. He deserve a genetic testing. Oh, Nunan is an autosomal dominant. I had to
Very
cheat
good.
because I forget.
So
It's an
actually,
autosomal dominant, so
okay,
50%.
actually, this is a case of leopard syndrome.
Ah, not Nunan. Okay.
It was
Do you know
no,
when you
it's a
show me
subvariety.
the
It is
rash,
a
it came to my mind. It
listen to
is.
me. Listen to me. It is a
Mm,
subvariety of Noonan. It is actually Noonan. But if the
mm-hmm,
patient with the
mm,
Noonan features, Turner features present with rash, it is leopard syndrome. Only
mm.
difference is bus. With
Yes,
rash, it's a leopard syndrome. It is
leopard
a
syndrome.
subvariety of Noonan.
Okay.
Otherwise, everything is same and it is autosomal dominant, not recessive, autosomal dominant.
Yes, I agree. Yes, it's autosomal dominant.
And
So I have to
the
tell.
high blood
What
pressure,
about the simian crease? What you told? Why you asked me
it is
about this?
Palmer
As if
crease,
there's
Palmer single crease. So the differential will be Turner, Noonan, and Down syndrome. In three
so
cases,
the
you can see this
differential.
single Palmer crease.
Okay.
There will be small hands, low set ears, triangular faces, hypertelorism, yani there will be wide difference between the eyes. Normally, there's a less difference than on examination. Pectus excavatum, pectus carinatum, sensory neural hearing loss. There may be pulmonary stenosis on in the cardio, ASD, VSD, hookum, and
Yes, that's
undescended.
why I checked the apex because I remember they have some cardiomyopathy diseases. Oh my God, but really, thanks. You made me do a brainstorming. I'm really sweating to hell.
No, mashallah, you read the diagnosis. Only the difference was of the rash. If there was no rash, it was a case of Nuna. If
Noonan
patient
and
present with this,
leopard.
such
Okay,
rash,
syndrome.
such rash,
I
then
get
it's a
this point.
leopard syndrome.
Really, thanks. And to be honest, it's not even in my notes. And if I would go and read about Noonan, I would not find this. So it was a very valuable addition. Thank you so much.
Yes, your approach was very good because in the beginning you asked me how you will approach if there is any case of learning difficulties. Two questions, but only to a rash. If the patient present with rash positive, number one diagnosis tuberous sclerosis. If then second will be leopard syndrome. You will ask the height. Height is less, leopard syndrome. If rash is negative, and then you will ask the height. If height is less than the normal, then two Turner or Nuna. Bus. Why I told you okay, I'm adopted? Why? Because if I will tell you, because my family members also having same problem,
Then it
so
will
you
be
can judge
revealed
it
from the start.
immediately. That's why I made it intentionally that I was
Adopted.
adopted.
I
I was
agree
adopted.
with you. Usually, whenever the patient have a lot of dysmorphic feature, they prefer to make the candidate really discover everything by himself.
Yes, yes, yes. But on the whole, you did very well. Your history was very good. Examination, mashallah, okay. And your uh, differential, almost. You told me Turner Down syndrome. But only a little bit. This rash was confusing for you.
Can you write the case, Dr. Azhar, the syndrome?
Leopard syndrome, you mean the spelling? Here it is.
LOPARD, Leopard syndrome.
Okay, this is the first thing. The second thing, the rash. What the description of the rash?
There's nothing.
It's
Only
not like
Turner.
nevi.
Huh?
Nevi.
This
Is it nevi?
لا هي lentigos, I think. Usually in leopard, I was reading just now because when you ask about the name, it is lentigo, what we called lentigo or lentigious diseases. Okay, this one I will post for you. Syndrome, let's see, lentigious profusa. This is the name of the rash.
I think this case beyond the basis exam.
Wallahi, I don't know, but at least it made me. This is the name of the rash. But let's say
No,
that
the
if it
case.
was
The case itself.
كتبته بالجروب
Yeah,
تحت
okay.
الكيس leopard syndrome والname of the rash. بس يعني let's say that Noonan syndrome can come. So
Leopard
99% of the history I took was valid except this additional point of the rash.
And in the evaluation, investigation IQ level also you should also mention.
Yes, it can be something to be done that I can offer it. You are right.
Yes, and treatment will be symptomatic. You will involve multidisciplinary teams. You will have the growth charts, speech therapists, physiotherapists, occupational therapists, like this, and symptomatic treatment.
Yes.
I think in this case, if you mention Nunani, you did the full mark.
Well,
agree معك دكتور. يعني I will tell you something. usually the way you are approaching the case
Yes.
can make you. أنا دائما بقول هالمثال أسوأ خطأ the worst thing you can do is to do أو to do a CT contrast in a patient who is nephrotic patient.
Yes.
Imagine one doctor, he passed the exam despite mentioning I would do CT contrast. As simple as this information. يعني هلا نحن عم نحكي عن نانو ليوبارد، فهي أكيد حيسامحك فيها. For sure he will forgive
Yes.
you.
Yes.
That
Mhm.
candidate, he passed because the examiner told him, you are a good, safe doctor and your approach was perfect. I will forgive this oversight. يعني, he mentioned CT contrast to a
Mhm.
patient and the whole case was nephro. So
Mhm.
just he stopped him. He told him, are you going to give a contrast? He said, no, I'm sorry. Even though this might make anyone lose the case. So believe me, doing the case very well is more than enough. More than enough to get marks, irrespective of what will happen later on. Such a case, it's just like learning point. That there
Yeah.
are some syndromes, how to address despite you don't know what is the answer, how
Yeah.
to involve the other teams, your seniors, those stuff. But
I
really,
think.
thank you, Dr. Arshad. You did me a favor. I really
Yeah.
enjoyed your case.
Okay, thank
Yeah.
you.
Nice case, Dr. Azhar. Thank you so much. I want to add just comment for the examiner, as Dr. Hind said. I think what examiner give good mark and he passed this candidate. I think he's from the old-fashioned examiner. The new fashion examiner nowadays, they are not forgiving for small mistakes, not major, even small mistakes. Sometimes they are failing for them. This is what I faced and what I realized recently. I don't know if you have
I
another.
agree with you. Nobody would like to do any such a mistake. Yani, I would imagine how much that candidate was scared when the examiner stopped him and told him, are you going to give a contrast? Best try to make things easy on yourself because you don't want to lose your temper during the station. يعني try to control your feelings because sometimes you might still have a chance to save yourself by another question if you are fast, you are controlling your stress, you are يعني you are keeping yourself ahead of the examiner questions. But try to always have this hope that I'll still survive the station whatever your mistake. Believe
Yeah,
me,
I
still
agree.
you might have that kind of a good-hearted examiner who really help you. تمام؟
Yeah,
this is what I want to say. إنه don't lose
yeah,
the control over the station, whatever your mistake is.
yes, I agree. A nice question also by Doctor. What about the conception? I think, yeah, since he's having unresolved tests, how he will get conception, Dr.
Usually,
Razak?
I would say, usually the undescended testes, usually in the abdomen, they are
Mhm.
like atrophied already.
Yes, exactly.
If
So,
the orchidoplexy is not done early. But I would never also give a final answer that sometimes there is some associated deformities or dysfunction of the private organ associated with this genetic test. I will refer you to the gland doctor and fertility clinic. They are more expert and they would advise you about some advanced techniques which may work for you or may not. But
okay,
they
so
are the one who are professional or gonna
yeah,
be in a better position.
scientifically, is it possible he will have?
See, I don't think so لأنه usually التستس
Yes,
بيتحول لcancerous
yeah,
tissue inside the abdomen
exactly.
and except if it is in the inguinal التestis which is in the abdomen intra-abdominal, this is the worst prognosis. The one which is in the inguinal, you might have some surviving sperms, slightly better. So you don't know which undescending testis this patient have. And someone like me, he don't even know that there is undescending testis. So keep it open. Tell him that you have some kind of
Yeah, of
dysfunction
course I will,
or
but
yes, some disturbance in the private organ, which is part of this genetic disease, okay, or faulty codes condition you have. So it's better that the gland doctor and fertility clinic address this concern. They are more specialized in this than me. So I would really
yes,
keep it open.
yeah, agree. Thank you, Dr. Hind and Dr. Azhar. Very nice cases and brainstorming ones. I hope all of us learn from this case. Any question regarding these cases. Lunan is autosomal dominant. I think he has the possibility to have a kid.
He have a possibility to have what?
Kids.
Kids. ترى مو كلهم بيجوا بالفول picture. He might
Yes,
have a
so
normal
he might have
gonadal,
good,
yes.
yes,
He might
exactly.
have normal. He might tell you I did a surgery when I was young. يعني you don't know what case you will get. So they might did orchidoplexy. He might have normal testis. He might have it in the inguinal area. All those possibility are there. But since you are ready, you know the case, you will be able to address the concern. But I agree with you. Some of them ترى نونان ما عندهم learning disability. Some of them they have. I saw نونان عنده children, he's running a family, he finished his education. They said that he's not successful in his work and in his business like his other family member. بس يعني عادي نحن سليمين وصحيحين we don't run a business very well. So we couldn't say it's a learning disability or not. But he was, I took the history from him يعني. He was answering me legible questions, legible answers.
Okay,
No?
the last question, why hypertension in this case, Dr. Azhar? Yes.
Dr.
The hypertension,
Arshad said pulmonary stenosis, I think, right?
pulmonary stenosis, it may be due to hook'em.
Any coarctation here?
No, no, coarctation will be
Down.
internal.
Mm.
Turner
Down.
will be A, B, C, D. A mean aortic dissection. B, this will be bicuspid
Bicuspid
aortic.
aorta,
C,
yes.
the coarctation of aorta. A, B, C.
This is for tenor. Down, they do have this coarctation? Down.
Down, I'm not sure. I'm not sure about down.
So it's internal 100%, yes.
Yes.
Cardiac,
Okay.
yes, cardiac.
Okay. Any question? Causes of hypertension, yes, mentioned already. Pulmonary hypertension, although it's not with all cases. Any question else? Okay. Seems satisfied. And also it's late. Thank you, Dr. Azhar and Dr. Hind. Very nice session and cases. Although the second one is very rare in the exam, I think. But we have to know everything and the possible rare cases. If no more question, we can end the session. Thank you for practicing today. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much, guys.
Thank you,
See
Dr.
you
Hind.
tomorrow.
Thank you, Dr. Azhar. Thank you.